Massachusetts is currently seeing a rise in the need for coronavirus tests. If you need to get one in the near future, it may not be as easy as you think. And Western Mass News reporter Jordan Jagelinzer getting answers for us on the reasons why. She joins us now live from her home with those details. Jordan.
Chris, if you go out and try and get a COVID-19 test, you may find that you can't get an appointment right away, and it may take several days to receive your results.
Currently, right now, in Massachusetts, we have seen a relative increase in the number of tests performed on a daily basis.
COVID-19 testing availability is less accessible than it was even a month ago.
It's created a bit of a challenge in some places, in some areas, with obtaining the adequate supply of test kits.
Dr. Robert Roos, Chief Medical Officer for Mercy Medical Center, tells Western Mass News part of the reason is that states are seeing more positive cases, resulting in more people needing tests.
If you have a positive test, you can quickly reach out to other people that have been in contact with that person and then have them tested or tell them to quarantine so you can reduce the spread.
But now that's getting a little tricky. With a higher volume of tests being done, it's resulting in delayed turnaround times.
There are certain labs, some of even the larger ones that are around, that have had delays in producing turnaround times that can be delayed from 3 to 5 to 7 or even longer numbers of days.
In which case, Dr. Roos recommends self-quarantining while waiting for results.
They're just not able to put the lab tests on the machines that they have because they're completely full every day around the clock and they're running at maximum capacity.
To help mitigate the spread,
I would recommend that people quarantine until they get that test result back out of exercising higher levels of caution.
He says Mercy Medical Center has been able to maintain favorable turnaround times, but they're choosing to prioritize the most at-risk patients.
It's like those in the hospital, those with symptoms, but we're also running into shortages and challenges with volume that in other cases, for less urgent matters, those tests are waiting a couple of days.
The good news, despite an increase in tests, Massachusetts continues to see a low percentage of positive cases.
The Massachusetts test positivity rate is down to its lowest at 1.4%, and we hope to continue to see that get lower.
And Dr. Roos says that you can plan ahead. So if you know that you may need a COVID-19 test in the future, make your appointment now since it could take several days for them to get you in. And then, of course, maybe you'll get your results back a little bit sooner. Reporting live from home, I'm Jordan Jagelinzer. Chris, back to you.